The 10 warning signs of a stroke you should never ignore. Have you ever wondered if your body gives you a warning before a stroke happens? The truth is, in many cases, it does. The problem is that most people don't recognize the warning signs until it's too late. Every minute after a stroke begins, nearly 2 million brain cells can be damaged. That's why acting quickly can make the difference between a full recovery and lifelong disability, or even save a life. In today's video, we'll explore 10 warning signs of a stroke that everyone should know. Stay until the end because the final signs are often mistaken for something harmless, and many people ignore them. Let's begin. First, what exactly is a stroke? A stroke happens when blood flow to part of the brain is interrupted. Without oxygen and nutrients, brain cells begin to die within minutes. There are two main types of stroke. The first is an ischemic stroke, caused by a blocked artery, which accounts for about 85% of all strokes. The second is a hemorrhagic stroke, caused by bleeding in the brain. Although the causes are different, the symptoms can be very similar. Now, let's look at the warning signs. Number 1, sudden weakness on one side of the body. If you suddenly notice weakness in your arm, leg, or even your entire side, don't ignore it. This is one of the most common symptoms of a stroke. Many people think they simply slept in a strange position or pinched a nerve, but sudden one-sided weakness should always be taken seriously. Number 2, a drooping face. Look in the mirror or ask someone to smile. If one side of the face doesn't move normally or appears to droop, this may be a sign that the muscles are no longer receiving proper signals from the brain. Number 3, difficulty speaking. A person experiencing a stroke may suddenly slur their words, struggle to form sentences, or say things that don't make sense. Even if the problem lasts only a few minutes, seek emergency medical help immediately. Number 4, sudden numbness. A strange tingling or complete loss of sensation in the face, arm, or leg, especially on one side of the body, should never be ignored. It may be one of the earliest signs that the brain isn't receiving enough blood. Number 5, vision problems. Some people suddenly lose vision in one eye, while others experience double vision or blurred vision. Because vision changes can have many causes, people often delay getting help. During a stroke, every minute counts. Number 6, severe dizziness or loss of balance. Feeling dizzy after standing up too quickly is common, but sudden dizziness accompanied by difficulty walking, loss of coordination, or trouble staying upright may signal a stroke, especially if it appears without warning. Number 7, a sudden severe headache. Many people describe it as the worst headache of their life. If an intense headache appears suddenly, especially with nausea, vomiting, confusion, or neck stiffness, seek emergency care immediately. This may indicate bleeding inside the brain. Number 8, confusion. Someone having a stroke may suddenly become confused, unable to understand simple questions, or forget where they are. Family members often notice that something seems off before the person realizes it themselves. Number 9, trouble walking. If your legs suddenly feel unsteady, or you begin stumbling without any obvious reason, don't dismiss it as simple fatigue. Difficulty walking can be an important warning sign. And finally, number 10, symptoms that disappear. One of the biggest mistakes people make is ignoring symptoms because they go away after a few minutes. This may be a transient ischemic attack, often called a mini-stroke. Although the symptoms disappear, it is a serious warning that a major stroke could happen soon. So who is most at risk? High blood pressure is the number 1 risk factor. Diabetes, high cholesterol, smoking, obesity, physical inactivity, excessive alcohol consumption, and certain heart conditions also increase the risk significantly. While age increases the likelihood of stroke, younger adults can experience strokes too. Doctors often recommend remembering the word FAST. F stands for face drooping. A stands for arm weakness. S stands for speech difficulty. T stands for time to call emergency services immediately. If you notice even one of these signs, don't wait to see if it gets better. Fast treatment can reduce brain damage and greatly improve the chances of recovery. The good news is that many strokes can be prevented. Keep your blood pressure under control. Stay physically active. Eat a balanced diet rich in fruits, vegetables, whole grains, and healthy fats. Avoid smoking, limit alcohol, maintain a healthy weight, and have regular medical checkups to monitor blood sugar and cholesterol.
If you liked the video, Don't forget to subscribe to receive all the latest reliable content.